Welcome back to Morning Joe. It is 29 past the hour. We are joined now by the director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci. Thank you very much for joining us this morning.
Doctor, thank you so much for being here today. And we really, most importantly, we want to thank you on behalf of our family and loved ones and seniors across America. We want to thank you for the service you're providing to America. It means a lot to all of us.
Thank you. Thank you.
So where are we right now? We obviously have stumbled. We can all talk about what we haven't done over the past month. Let's talk about where we are right now and what you think the next few weeks are going to look like.
Spike, they peak and they come down if you don't do anything. If you try and interfere either by preventing influx of cases from the outside, like with travel bans, which we're doing, as well as containment and mitigation, the kinds of things of physical separation of people. What you hope to do is to get that peak become a little bit of a hump. Now, that hump's going to be still a lot of people are going to get infected and a lot of people are going to get sick, but hopefully it will be much, much less than the major peak. So two things we're looking for. A, things are going to get worse before they get better. But B, what's happening now with many more tests that are going to be going out very, very shortly. What's happening now with many more tests that are going to be going out very, very shortly, with people now very seriously taking containment and mitigation into effect. Hopefully we'll be able to blunt that peak. That's what I see in the next few.
I've read reports that actually closing down schools, which the French just did yesterday, K through 12 in the colleges, acts almost like a firewall against massive spreading of these pandemics. Just shut down for the next 3 weeks or so?
I think you need to do a proportion.
Just shut down for the next 3 weeks or so?
I think you need to do it proportionately. If you have a considerable amount, or even do not necessarily at all get serious disease. In fact, if you look at the history of what we've seen, children do very well. The only problem is when they get infected, and schools can be a breeding ground for that, they go home and infect grandma, grandpa, or a relative or someone who might be in a more vulnerable position. So that's the rationale for shutting schools.
Yeah, so let's move on to the testing question. Obviously not your domain. You expressed the concern that a lot of Americans have expressed that we have failed as a country over the past month.
DC, all of us together have been now pushing with the task force so that within, and I would say, you know, it's dangerous to give times, but I would think within a week, we're going to start seeing a real acceleration of testing. And then as we go 2-3 more weeks, it'll be much, much more. So I think we're going to see a much different situation than we saw just a few weeks ago.
So obviously for organizations, Dr. Fauci, across the country, schools, et cetera, it's hard to make decisions without testing, without information. So they're sort of flying blind. So then that leads to the question of self-quarantining. How important, you hear of some people making the decision to isolate for 2 weeks. How important is it to self-quarantine if you think you may have been exposed?
Well, I mean, obviously, if you feel that you're provider, to the clinic, to the emergency room, explain to them that you are feeling badly and figure out a way how to safely get tested. The idea of someone in an area of the country that is not having community spread to all of a sudden now start really self-quarantine, that's a bit much. What you should do is try and physically separate yourself from unnecessary interaction with large crowds. Unnecessary travel. Try and physically separate yourself from unnecessary interaction with large crowds. Unnecessary travel, particularly, and I want to underscore, particularly if you are an individual who falls into the vulnerable category, the elderly or individuals with underlying conditions, chronic congestive heart failure, heart disease, diabetes, et cetera, et cetera. The most vulnerable need to be much more serious in separating themselves from the general public.
And I appreciate that. So that answer was for people who are feeling symptoms, any types. But what about if you feel you've been exposed to somebody who has coronavirus, who has tested positive? Is it important? Is it mandatory?
That's for sure. But you should immediately, in lieu of getting tested, like within the next few minutes, you should try as best as you can to self-isolate yourself.
Dr. Fauci, it's Willie Geist. We appreciate you taking some time with us this morning. Just to piggyback on what Mika said, we know the President of the United States over the weekend at Mar-a-Lago himself was standing with and had physical contact with someone from Brazil who now has been diagnosed with coronavirus. Should the President himself be tested for coronavirus?
You know, I leave that to the president's physician. They have a very good White House physician and physician staff there. So when you have a situation of a patient-doctor relationship, the advice for that should come from the White House physician.
But generally speaking, if I were standing next to someone who had been diagnosed with coronavirus, should I isolate myself and find a test as well?
Yes.
Okay, so that goes for the president, likely, in theory at least? But you'll leave it to his doctor?
I'm going to leave it to his physician, who's a very good physician.
Okay, Dr. Fauci, the president said yesterday that there were 1 million coronavirus tests out there, with 4 million, he said, coming in the next few days. Is that an accurate number?
The number of what's out there is accurate. The difficulty was the connection between the people and the process, and connecting them with actually implementing the test was the reason why people, as you know, are calling in saying, I tried to get a test and I couldn't get it. Hopefully that's behind us. But looking forward, as I mentioned just a moment ago, we should start seeing an escalation of capability of getting tested.
Well, that's the disconnect a lot of people in this country, I think, see when they hear you say that. Okay, there are 1 million tests out there, and yet for most people, New York City, any other city they want, if they go in and say, I need to be tested for coronavirus, they're told, we just don't have them. You got to go home and isolate yourself and take an ibuprofen and drink fluids. So where is the disconnect, and why isn't it being connected?
Well, it is being connected now. There was a disconnect there for sure. We have to admit that. It's unfortunate, but it's going in the right direction right now. No denying there was a bit of a disconnect where people hear that a test could be available to anybody, and they go into a doctor's office and they didn't get it. That's unfortunate, but what we're looking now is looking forward, and hopefully in the next few days to a week or so, it's going to be a major escalation.
So what's changing, Dr. Fauci? What gives you that confidence that it is now changing, that a week from now, anyone who walks into a hospital or goes to see a doctor can get a test for coronavirus?
I'm not saying that anyone and everyone. I'm saying it's going to be markedly improved. And what has changed is that there's been a major involvement of the private sector. The companies that generally do these kinds of tests for a living are now going to be major league involved in getting this available to the public, whereas before it was mostly on the burden of the CDC as a public health organization. There's a lot of commercial issues out there that can be involved, and that's the thing that's going to change. It's getting the private sector involved.
So, Dr. Fauci, let's move to another area. And again, these are a couple of areas that obviously I think will help us be more prepared for the next pandemic. And we've talked about testing. Let's talk about ventilators. Obviously, I'm sure you're concerned. We see what's going on in Italy right now. CDC, New York Times reporting, said we could have anywhere from 2.5 to 21 million people in hospitals. We only have 950,000 hospital beds, and obviously a massive shortage of ventilators to take care of a pandemic. What should we be doing to not only alleviate whatever suffering we can in this pandemic, but to prepare for the next pandemic?
You know, we have a pandemic preparedness plan that was put into effect back when we had the concern about the bird flu, the H5N1. You might remember that. It was put into effect, and it made us much better prepared. We have things in the strategic national stockpile. Many of the elements that you just mentioned are there. So right now, if you compare to where we were 20 years ago, we're much better prepared. But when you have something that potentially can be a really dramatic type of pandemic, the way they're seeing in Italy right now, systems could be overrun. So when we get through this, and we will get through this, we've got to go back and say, you know, we've been talking about this happening We've got to be making sure that we never, ever let the strategic national stockpile get underfunded. We've got to do that. We have a lot of stuff in the strategic national stockpile, more than people realize, but even that can get overwhelmed when you have a major outbreak.
You know, we look at these countries across the globe. They give us a good warning about what may be coming our way. You've talked about Italy. Are we following the path of Italy right now, or South Korea, China? Based on what you've seen, based on the numbers, I mean, we've seen people follow the lines up, say that it looks like we're following the path that Italy has taken, unfortunately, over the past month. Any idea, based on science,
Sure.
which direction we're heading?
Well, yeah, exactly. If you do nothing and you wait too long to institute aggressive containment, mitigation, and preventing from outside sources coming in, the way we did with China and that we're now doing with Europe, that's critical. What happened with Italy, unfortunately, and I say that with great pain because I have so many friends and colleagues who are over there right now, people that I've trained myself. What happens is that they did not prevent the influx of cases. So before they could even get started, their peak was up here. When you approach the peak up here, it's much, much more difficult to get it to come down. If you're going like this, and you know if you leave it alone, it will peak. If you start right here to do aggressive measures, you may, instead of making that peak do that, you get a little bit of a hump. Now, that hump's still going to be a lot of people getting infected, sick, and maybe even dying, but much less than what Italy is going through now. So what I'm saying is that we're trying to avoid.
Have we started early enough our aggressive containment strategy? Has it started early enough to avoid that peak that Italy is experiencing?
As I mentioned, there are two components of that. There's preventing from without to in, and there's what you do mitigation in. Clearly, early on, we made a travel ban with regard to China. That was a very smart move right there, because what that did was prevent a major influx from China. Today, the new China is Europe, because Europe now is the major element, the major geographic component that is now seeding other countries throughout the world. And that's the reason why we made the very difficult but appropriate decision to have a travel ban on the European countries. So we are definitely ahead of the curve on that. What we've got to continue to do is within now the kind of mitigations that you're hearing about. Yeah. Separation physically from large crowds, where appropriate, closing schools, teleworking, and things like that.
All right, great advice. Dr. Fauci, thank you. And thank you for the service to this country. We all greatly appreciate it.
Very much.
Thank you.
Thank you for the service to this country. We all greatly appreciate it.
Very much.
Thank you.